If you want a short and to the point video that goes over all the basics involved in enrolling into Medicare and how Medicare works, you came to the right place. Let's get into all the details right now. Hey, Andrew Walsh here. I'm an independent Medicare broker helping people across the country with their Medicare choices. If you are new here, make sure to click that subscribe button. And if you ever need any help with Medicare, feel free to reach out to me. My contact information is in the video description below. Okay, most people become Medicare eligible at 65. Medicare always starts on the first day of the month, and you are automatically enrolled into Medicare at 65 if you're collecting Social Security or Railroad retirement benefits. If you are still waiting to collect on your Social Security benefits, you will need to manually enroll into Medicare. And you can manually enroll into Medicare up to 3 months before you turn 65. And you will need to contact Social Security to enroll. You should usually enroll into Medicare if you or your spouse do not have employer or group health insurance coverage, or if you or your spouse is still working and receiving employer or group health insurance from an employer with less than 20 employees. If you or your spouse are receiving employer or group health insurance from an employer with more than 20 employees, you can delay enrolling into Medicare until you decide to retire or make the transition onto Medicare. Make sure to compare your current coverage to Medicare and also check with your benefits department at you or your spouse's work to make sure you can delay enrolling into Medicare. People with retirement health insurance coverage should also check with their past employer's benefit department to see if they should enroll into Medicare or not when they turn 65. Now, Medicare is broken up into two parts, Medicare Part A and Medicare Part B. Medicare Part A pays for your inpatient care at the hospital, and it covers Medicare services that require admission into the hospital. Medicare Part A also covers time spent in skilled nursing facilities, nursing homes, home health care, and in hospice care. Most people will get Medicare Part A for free because either they or their spouse paid Medicare taxes while working. If you or your spouse did not work and pay payroll taxes for at least 10 years, you will need to pay for Medicare Part A out of your own pocket. Next, there's Medicare Part B. Medicare Part B pays for your outpatient care, and Part B pays for things like doctor's appointments, lab tests, and surgeries that are needed to diagnose or treat a medical condition without being admitted into the hospital. Medicare Part B also covers Medicare-approved preventive services, durable medical equipment, ambulance services, and drugs or medications you would not usually give yourself, like shots and injections you get at the doctor's office. Medicare Part B is not free, and most people will pay $148.50 a month for it. You will need to pay more for Medicare Part B if you make more than $88,000 filing taxes individually, or $176,000 filing taxes jointly. Now, Medicare is very good coverage, and you can go to any hospital or doctor in the U.S. that takes Medicare patients. You don't need any referrals or prior authorizations because you and your doctors are in charge of your care. Medicare Part A and Medicare Part B are not perfect though, and both of these parts of Medicare do have some gaps in coverage. There are two major gaps in coverage for both Medicare Part A and Medicare Part B. With Medicare Part A, you will need to pay the first $1,484 if you're admitted into the hospital. This is called your Medicare Part A deductible. And you can end up paying for this $1,484 deductible more than one time per year if you're admitted into the hospital more than 60 days apart. The second major gap with Medicare Part A involves skilled nursing facility care. If you qualify, Medicare Part A covers your first 20 days in skilled nursing facility, but you must pay $185.50 a day for days 21 through 100. Medicare Part A will not pay for more than 100 days in skilled nursing facility care or for more than 150 consecutive days in the hospital. The two major gaps in coverage with Medicare Part B are the $203 Medicare Part B deductible and the 20% coinsurance you need to pay for all outpatient Medicare services after you meet the initial $203 deductible. It's important to understand that the 20% coinsurance you pay after the $203 deductible is not capped. This means you have unlimited risk with Medicare Part B. So for example, you would need to pay about $2,000 for a $10,000 surgery with Medicare Part B. Medicare as a whole also does not pay for most dental and eye care, cosmetic surgery, hearing aids, and routine foot care. Lastly, Medicare does not cover you outside the United States. Medicare does pay 100% for some preventive services, but you should always check with your doctor or provider to make sure a preventive service or any other service you are considering is covered by Medicare. Now, if you want better coverage than just original Medicare, you can enroll in either a Medicare supplement plan or a Medicare Advantage plan. You cannot have both of these at the same time. If you choose a Medicare supplement plan, you will be staying on original Medicare, and the Medicare supplement will pay for most of the gaps in Medicare. If you choose a Medicare Advantage plan, you'll be replacing your original Medicare coverage with private insurance that must at least cover what Medicare covers. You will still need to pay your Medicare Part B premium of $148.50 per month for both of these options. Now, here are some advantages and disadvantages for each. Medicare Advantage plans are lower cost, with their most popular plans having $0 premiums. Most include drug coverage and also have some benefits for hearing, dental, vision, and wellness. The negatives of Medicare Advantage plans are that you have to go to their networks of hospitals and doctors. Medicare Advantage plans also have lots of different gaps in coverage, just like original Medicare. And you pay a portion of your bills until you reach the max out-of-pocket on the plan. Medicare Advantage plans can have max out-of-pockets of up to $7,550. Lastly, Medicare Advantage plans change yearly and are more expensive in the long run for chronic conditions. Medicare supplement plans, on the other hand, have predictable costs, and they do not have networks of hospitals and doctors. This means, just like original Medicare, you can go to any doctor or hospital that accepts Medicare patients. Medicare supplement plans also cover some to all the gaps in Medicare. Lastly, Medicare supplement plans are standardized and guaranteed renewable, so the plan stays the same for life. The only real disadvantages with Medicare supplement plans are that you need to pay a premium for them, and this premium will increase over time. You will also need to purchase separate Medicare Part D prescription drug coverage with a Medicare supplement plan. I cannot go into all the details and give you examples of different Medicare Advantage plans because they are heavily regulated. So if you do want to learn more about them, make sure to work with a local agent that knows how the local plans and networks work and also represents multiple carriers. But I can get into the details about Medicare supplement plans because they are standardized by the government, and all Medicare supplement plans offer the same basic benefits. There are 12 standardized Medicare supplement plans, but only a few are priced competitively based on their standardized benefits. The two most popular plans right now are Medicare Supplement Plan G and Plan N. Plan G is easy to understand, with it covering 100% of the gaps in Medicare with one exception. And that exception is that Plan G does not cover your Part B deductible. The Part B deductible in 2021 is $203, so with a Plan G you pay $203, and then all your out-of-pocket costs from that point until the end of the year are covered 100%. Then there's Plan N. Plan N also does not cover your $203 Part B deductible, much like Plan G, and it also has $20 copays for doctor visits and $50 copays for emergency room visits. Plan N also has what's called excess charges. Part B excess charges are when a doctor or specialist can charge up to 15% more than what Medicare is willing to pay for a test, surgery, or procedure. These excess charges are rare, but you do need to take them into consideration when making a decision. Monthly premiums for plans G and N are different from state to state and even for different zip codes within each state. I ran quotes across multiple states for people turning 65 and found on average Plan G was $104 a month and Plan N was about $85 a month. Now, because Medicare supplements are standardized by the government, you can get them from any Medicare agent around the country. And you're better off looking outside your local area to get the best deals for Medicare supplement plans. It's very important to understand that different Medicare supplement insurance companies charge different premiums for the exact same plans. Okay, the last piece of the puzzle we need to cover is Medicare Part D, or your prescription drug coverage. Most Medicare Advantage plans have Medicare Part D rolled into them, but you will need to pick out a Medicare Part D plan if you decide to go with a Medicare supplement plan. Medicare Part D plans are run by Medicare-approved private insurance companies, and you pay a premium to lower the cost of your prescription drugs. Every Medicare Part D plan has a list of covered drugs or a formulary. This means that they put different drugs into different tiers and have different costs for each tier. These Medicare Part D companies can change their formularies each and every year, so it's always important to check and see if you are on the lowest cost plan for the drugs you are currently taking. The best time to do this is during your annual election period. The annual election period runs between October 15th and December 7th of each year. Changing your prescription drug coverage during this time will make your new coverage effective on January 1st of the upcoming year. Medicare Part D plans are relatively inexpensive, but you may need to pay a little bit more for a plan depending on your medications that you are currently taking, or if your current income is above $88,000 filing taxes individually or $176,000 filing taxes jointly. Now, here's a simple game plan for anyone who's planning on starting Medicare soon. First, you'll need to get on Original Medicare Parts A and B. Some of you will be automatically enrolled into Medicare because you're collecting Social Security, and you'll receive your Medicare card about 3 months before you turn 65. Others will need to manually enroll into Medicare because they're turning 65 and they're still waiting on their Social Security benefits. Or they're over 65 and will be losing group or employer coverage soon. These people will need to go to their local Social Security office, call Social Security, or go online to set up Medicare. Social Security's phone number is 1-800-772-1213, and their website to set up Medicare is www.ssa.gov/benefits/Medicare. Make sure to do this 60 to 90 days before you intend to start Medicare so you don't have any delays in starting of Medicare or any late enrollment penalties. Next, after you have your Medicare card, you should meet over the phone or in person with an independent Medicare agent to discuss your options for a Medicare supplement or Medicare Advantage plan. If you decide to go with a Medicare Advantage, you'll most likely be done. But if you do decide that a Medicare supplement is best for you, then you'll need to pick out a Medicare Part D prescription drug plan. To pick out a Part D plan, just call Medicare or go online to enroll. You can call Medicare at 1-800-633-4227 or go online to www.medicare.gov/plan compare. Make sure to have your prescription drug list, Medicare card, and your preferred pharmacies ready to go before you call and pick out a plan. The least expensive option is usually the best choice. So it's as simple as enrolling into Medicare, picking a Medicare Advantage or Medicare supplement plan, and then enrolling in a Medicare Part D plan if you decide that a Medicare supplement is right for you. When you're on Medicare, you can change your Medicare Advantage plan and Medicare Part D prescription drug plan every year during AEP, or the annual election period that runs between October 15th and December 7th of each year. Anything you change will then become effective January 1st of the upcoming year. You can do this without answering any health questions, so if you aren't happy with your Medicare Advantage or Medicare Part D prescription drug plan, you can change it at the end of the year. Medicare supplements are a little more difficult to change because 6 months after you start Medicare Part B, you'll need to answer health questions to qualify to change plans. This means it's easier to go from original Medicare with a Medicare supplement to a Medicare Advantage plan than it is to go from a Medicare Advantage plan back to original Medicare with a Medicare supplement. Thanks for taking the time to watch this video. If you need any help with your Medicare enrollment, feel free to reach out to me or ask me any questions in the comments section below. My phone number is 920-960-4312, or you can email me at medicarescreenshare@gmail.com. The phone number and email will also be in the video description, along with any updated Medicare information for the current year. You can also click on a very similar video to this one that goes over way more detail about enrolling into Medicare as soon as this video ends. The video is 31 minutes long and expands on a lot of the information that this video covered. And as always, please like, comment, and subscribe so we can help more people. Or Medicare Advantage plans. Get out of here!